So really briefly, with us today, you see myself there. We have Mr. E. Taylor, doctor, and team. If you are off camera, please feel free to come on camera and give a hello as I present you. We have Mr. E. Taylor, doctor. We have Lisbeth Garcia Acosta here as well. Also not shown on the slide, we have Rachel Sadlon. And we have our student intern, Miss Katie Rose Carr, on the line today as well. So briefly, let's talk about what we're going to do. So we've already done introductions and we've already done the housekeeping. We're going to do a few icebreakers this morning. We're going to do a little bit of a deep dive into menstrual equity and what that means. Of course, as shared, we're going to do some Q&A. We'll do a review and recap of the information shared today, and then I'll close out today with sharing some resources that you all can utilize. And just as a heads up, because we are presenting in Teams, if you're joining us today through Teams, you can click on any links that are in the presentation live through the presentation so that you have access to them quicker. We will be sharing out the slide deck after this training as well so that you have access to those resources. So today we are going to learn a couple of things through your participation. We're going to talk about and recognize the legislation that supports menstrual equity, both nationwide and right here in the District of Columbia. We are going to discuss menstrual equity and differentiate between what menstrual equity is and period poverty is. And then we're going to have an opportunity to review some scenarios and employ some strategies and best practices to respond to concerns related to menstrual equity. And so we have an opportunity to look at menstrual equity concerns from a student, staff, and parent perspective, and I'll give you all an opportunity to sort of practice your response to those scenarios in this session. So before we begin, as I shared, let's break the ice. So I'm going to activate a Slido poll here. And what I wanted you to do is go into that Slido and explain your ideal vacation using emojis only. So when you get into Slido, you'll see where you can chat. There's a separate button for emojis that you can press, and you can put in what emojis explain or describe your ideal vacation, whether it's hiking, whether it's laying out on the beach, whether it's just taking a second to dive into your favorite book that you haven't been able to finish yet, but using, again, emojis only. So let me go ahead and activate that Slido for you now. You have multiple ways of accessing the poll here. You can go to slido.com and type in the code that you're seeing on your screen, 2859390. You can also click the link. As I shared, links are live in this presentation, so you can click the link to the Slido poll here. Or if you're on your mobile device or have your mobile device handy, you can simply scan the QR code, and that will take you directly to the poll as well. So that poll is now live, and I see some folks posting already. I see we have some fans of the beach. Ideal vacation so far is the beach. Oh, I like this, multiple icons. Let's see if I can share my screen. I'm seeing some getting the nails done, some manicures. I see, again, a beach here, and then seafood. We gotta love seafood. Sorry for those with seafood allergies and shellfish allergies, but I'm seeing some shrimp and lobster over here. Sounds like my ideal vacation as well. Seeing some sushi in there. Surfing, all right. I see some surfboards in there. That sounds fun. I haven't been able to tackle surfing yet, but boogie boarding, I'm all about it. Okay, and I see some healthy eating going on in here too. Some avocado, okay, very nice. All right, so now that we've sort of know what each other's ideal vacation looks like, let's talk about how knowledgeable we are about menstrual equity. And this is just an opportunity. These answers are completely anonymous, so we can't see who is responding in which way. But I want to hear a little bit about how you're feeling about menstrual equity and how knowledgeable you feel about the topic. So I'm going to make that poll live for you now. Unfortunately, I'm going to close out of our ideal vacation and move to that slide. So again, slido.com, code 2859390, or the QR code. And you have a few options in here. You can share whether or not you feel like you're an expert on menstrual equity, if you have just some solid background knowledge. Maybe you have very basic knowledge of menstrual equity, or you're completely new to the topic and you're here just to learn about what menstrual equity is. But that poll is now live, so we'd love to see how you're feeling, just to see who's in the room with us this morning. I see a couple responses in here. Looks like we have some folks with some solid background in the room. That's excellent. Oh, an expert. Okay. Somebody in here can present this can do this presentation on my behalf. Great. Wonderful. I'm seeing some folks who have basic knowledge in here, which is good. Hopefully by the time you leave today, you will feel more like you are in that category of solid background information or expert. So far, no one completely green or completely new to the term menstrual equity or period poverty. So that is wonderful. All right, and I'm going to leave that open for just a couple more seconds as I move forward. So as I shared earlier, we're going to talk a little bit about the legislation and the bills and acts that have led to a major focus on menstrual equity, and there are two main legislative bills here. The first is the Menstrual Equity for All Act of 2021. This act expands access to free sanitary napkins and tampons in certain locations and for particular groups of people, mainly those with limited access. And we're going to talk about what limited access looks like a little bit in this presentation. This bill also requires Medicaid to cover menstrual products, as well as liners, cups, and similar items used by individuals with respect to menstruation. The bill also imposes the requirement to make free menstrual products available in federal and state and correction facilities and restrooms in federal buildings that are open to the public. Finally, this bill established a grant program that supports free menstrual products on campuses of higher education and permits elementary and secondary schools to use grant funds to provide menstrual products to students. To note, this bill also requires, and you may not have to know this, but this bill also requires employers with at least 100 employees to provide free menstrual products for employees. There's also a provision within this bill that allows programs like programs that provide emergency food assistance and shelter to provide menstrual products to homeless individuals as well. And so again, this legislation is nationwide. Let's move to DC specific. So in 2022, the Expanding Students Access to Period Products Act imposed a few changes. It imposed that local education agencies and private schools install at least one dispenser or similar container for period products in each women's bathroom and gender-neutral bathrooms in every middle school and high school, and at least one women's and one gender-neutral bathroom in elementary schools. If a school building does not have a gender-neutral bathroom, then the period products dispenser shall be available in at least one men's bathroom. The act also requires that LEAs in private schools stock every dispenser with appropriate products that are available, free and available to students in schools throughout the academic year and in schools that are offering summer programming. This act also requires that DC institutes of higher education also install at least one dispenser or similar container for period products in women's and gender-neutral bathrooms, and that these dispensers should be stocked in full and have free access to period products for students. Throughout the calendar year, the required products are made available and free of charge. Finally, this act requires that OSSE develop signs that include medically accurate information on the safe use and disposal of menstrual products. The signs shall be placed near each dispenser or similar container for period products and should be made available for download in PDF format on the OSSE website, which is actually available now, and we'll be sharing again the link to that webpage for you to access that poster. And then finally, the Expanding Students Access to Period Products Act of 2022 required that OSSE develop and implement health education standards on menstrual education designed for all students, regardless of gender, and that these standards should be made available to both DCPS schools and District of Columbia public charter schools beginning in grade 4. The overarching vision of the health education standards, the menstrual health education standards, is to provide students with information that supports and enables the school environment for students to be able to manage their menstruation and their cycle with dignity. Yeah, so that it empowers students. So here's our last and final Slido poll. Now that we've gone over the two legislative bills and acts that primarily focus on menstrual equity, I want to hear from you all what menstrual equity means to you. I am going to read through some of the responses. I see here inclusivity, it's important, access, yep, we'll talk about access in this presentation, dignity, comfort, no stigma, very good. This is a good one. Ensuring every student has comfortable and safe access to the products, information, and support they need to stay healthy and happy. I love that. Menstrual equity is access to menstrual hygiene products and education. Yes, we'll talk about that. Organic and safe products for all. This is a good one. Addressing social, economic, and cultural barriers. I love that, right? We know that those are some pretty strong barriers to menstrual equity, and we'll talk about social, economic, and cultural barriers as well. Empowering, yes, that's a huge part of menstrual equity. Empowering menstruators and non-menstruators, all students, all individuals to learn about the menstrual cycle and to be advocates of menstrual equity. I see one more person typing, so I'm going to leave it here. Yeah, very good. Elimination of period stigma, absolutely. Yeah. All right, I'm going to leave that poll open. Feel free, if anything that I say in the presentation jogs your memory or jogs additional thoughts, you can put them in here in the poll. I'll leave this open. So what is menstrual equity? As you all just showed, menstrual equity means a lot of things. The definition varies significantly, but mainly consists of three main components. Something along the lines of affordability, something along the lines of accessibility to menstrual products, and then generally there's a component of safety around the use of menstrual products or the discussion around the menstrual cycle. But menstrual equity isn't just about period products. Menstrual equity is about a lot of things. It's about education. It's about ensuring that menstruators have equitable access to education about the menstrual cycle, including the phases of the menstrual cycle, menstrual products and how to use them, pain management techniques, and menstrual irregularities, just to name a few. And that list goes on. It's also about reproductive care. It's about ensuring menstruators know about and can make the right choices for themselves around the use of contraception and the impact of contraceptives on the menstrual cycle and ovulation. It's about ensuring that menstruators have the support that they need and are empowered. We heard that word and we saw that word in the Slido poll, that students are empowered to make the best choice for themselves about how to manage their cycle, that they can identify a trusting adult who they can confide in about their menstrual cycle, or know where to go should they have questions about anything pertaining to the menstrual cycle. And I apologize, you're going to hear me keep saying students, then individuals. Again, the primary focus of today is the rollout of the menstrual health education standards that is specific to students in DCPS and public charter schools and institutes of higher education, but know that this applies for all menstruators, not just students. Menstrual equity is also about ending the stigma. I saw that come up and I read that in the Slido poll as well. We're trying to end period stigma. And so menstrual equity also includes conversation around ending the stigma around periods, right? We want students, again, to feel empowered to talk about and be advocates for menstrual health and equity. And that includes ending period discrimination, period bullying, social taboo around the menstrual cycle, and gender stereotypes that stigmatize menstruation. And by the way, equity is about making sure all individuals are empowered to talk about the menstrual cycle and be supportive advocates on behalf of menstrual equity. And so everything that I just spoke through, it doesn't just apply to menstruators, it applies to non-menstruators too, including our young boys and our men. They need to know about all of this same information. And finally, I want to share here that the definition is continuing to grow and change, right? As we continue to lift up menstrual equity, as we continue to fight the battle to end period stigma, and as this conversation happens, not just here in the US, but throughout the world, the conversation changes just a little bit each time we keep talking about period health, product access, affordability, education, and safety. And so the definition continues to evolve. So why is menstrual equity important? It's important for a lot of reasons. On average, the age of menarche in the US is 11.9 years of age. But we've seen that students can experience menarche as early as 8 years of age, and in some cases, we've seen it happen as early as 7. So it's important to talk about the menstrual cycle. It's important to begin having the conversation about menstrual equity as early as elementary school, because we know, again, students are menstruating this early. It's better to be proactive in these conversations than reactive in the case that students, so that students are prepared for menarche and not caught off guard. Equal access to period products is an equity issue. On any given day, there are about 800 million people on the planet who are menstruating, of whom at least 500 million lack the adequate resources that they need to manage their periods. This could mean having access to products and supplies. This could mean having access to the resources such as, facilities. This could mean access to information or even access to support or any combination of all of those things. There are also many factors that impact access to menstrual hygiene products, which is, again, an equity issue. Some of those things include poverty. We know that menstrual products can be costly, and poverty poses a significant barrier to accessing those products. On average, you can expect that individuals who menstruate will spend upwards of $1,000 over the course of their lifetime on menstrual products. For many who can't afford those products, this often means that they're resorting to unhygienic options like using cloth, rags, diapers, or toilet paper as substitutes for period products. Public assistance is another factor that impacts equity here. Those who receive public assistance face additional hurdles, right? There are many government assistance programs like SNAP, the Supplemental Nutrition Assistance Program, or the Women, Infants, and Children Program, WIC, which are designed to provide nutritional support for children and families and pregnant women or postpartum mothers that cannot be used to purchase menstrual products in many states. Not all states, but in many states. And under the laws governing these programs, folks who trade those food stamps or trade assistance or resources for period products can face some pretty harsh penalties, right? They can be jailed, they can be fined, or they risk losing their benefits. For struggling parents, they may borrow money just to buy menstrual products to last them through each cycle. Or, again, as shared, others may illegally sell their food stamps for cash to buy menstrual products or other necessities, which again places them back in a circumstance where they risk losing their benefits or facing even harsher punishment. And then that $1,000 that I quoted earlier, that's just the net price of products, right? We're not talking about tax and taxation on menstrual products that make them even more expensive, that also make them a little bit more out of reach for students. For individuals. And let's not also forget about homelessness and housing instability. That has an impact on equity as well. Folks who are experiencing homelessness report higher rates of infection caused by using tampons and pads for longer than they're recommended, or for improvising with items such as paper towels or newspapers to manage their cycle. This also includes, again, the focus is on students for this day, but this also impacts our homeless students, our students who are living in transitional homes, those who are couch surfing and living with friends and family who don't have a consistent place to lay their heads. They're categorically described as homeless youth. And so all the statistics that I just shared about homelessness and instability, that impacts our homeless students as well. And I would be remiss here not to share and just to hammer home the point here, in the District of Columbia, 40% of our youth experiencing homelessness also identify as LGBTQ. So consider this when you're thinking about our transgender youth who also already face the highest rates of inequity and lack of access to menstrual products. Finally, menstrual equity is important not just because it impacts all menstruators, but again, it has a profound impact on our population, the folks that we work with the most, and that is our students. In the US, 4 out of 5 students say they have or know a peer who has missed time in school because they don't have access to the period products they need to manage their cycle. Again, I'll say it again as we sit with that. 4 out of 5 students miss time in school or know somebody who's missed time in school because they don't have access to the products that they need to manage their cycle. And missing school is obviously the worst possible outcome here, but even students who may not miss school completely for the day or 2, 3 days, they may be less likely or less productive and engaged in the classroom, even though they don't miss school. So students who lack access to menstrual products, also similar to all other statistics that I shared earlier about homelessness and assistance, our students who lack access to menstrual products will also improvise as well with toilet paper or other alternatives and risk bleeding through their clothing, which ultimately can end in students leaving school early, facing potential period bullying, embarrassment, and humiliation. This can lead to lifelong consequences and traumas. And of course, absenteeism from school can lead to significant performance changes, right? Students who miss school don't perform as well. They also tend to be socially disengaged. They can have feelings of alienation and other adverse outcomes which can span into adulthood. So the last thing I'll share here on this slide is, again, while we're focused on students, I do want to share that period poverty also disproportionately affects Black, Latina, immigrant, and first-generation students, right, at much, much higher rates than others. And so a 2022 study recently showed that nearly 19% of African-American high school students reported having to choose between buying period products or other necessities like food and clothing, and that number jumps to 23% for our Hispanic students. Similar trends are seen amongst college students as well, so it's not just impacting high school students, it's impacting students across the board. So even in our college student population, 1 in 4 Latino students and 1 in 5 Black college students report chronic period poverty or reported chronic period poverty in the last year. And so this is a serious issue. And just to close out on menstrual equity here and the importance of it, as I shared earlier, menstrual equity is about empowering all students. And so anyone with reproductive anatomy associated with being assigned female at birth, or AFAB, can menstruate. That includes cisgender girls, transgender boys, and non-binary people with AFAB parts, right? They all have periods. And so if you're curious about why period product dispensers need to be available in women's gender neutral and men's bathrooms in certain circumstances, it's because we have to be equitable, right? We need to make sure that anyone who's menstruating has access to the products that they need. And that includes finding products in the bathroom of the gender in which they identify. Again, I shared earlier, again, I just want to hammer home here, 500 million out of 800 million menstruators say that at some point they don't have everything that they need to manage their menstruation. And so you've heard me say a lot about menstrual equity here, and I've dropped the word period poverty or the term period poverty a few times throughout. But I want to be sure that we make a distinction between the two because the two terms are often used synonymously, but are slightly different concepts. And so I want to take an opportunity to just break down the differences here. Either way, regardless of which term you use, the major problem here is that they both prevent access to something related to the menstrual cycle, or menstrual health and education. Period poverty relates specifically to the lack of access to the resource or the tool that allows individuals to get the period products that they need, which is 9 times out of 10 going to be money, right? Period poverty tends to focus specifically on the period products, where menstrual equity is about the access and barriers to things not necessarily tied to the products. That can be education, so lack of access to education, lack of access to resources. It could be a trusted, supportive adult, lack of access to information, or lack of access to a strong support system in which students and individuals, administrators can reach out to if they're having questions about their cycle, questions about products, questions about potential irregularities that they might be seeing. Menstrual equity can include the products too, but it's a much broader scale of things, right? It's about the education, the height, slightly about the products, and that support system where period poverty again tends to focus specifically on menstrual hygiene products or lack of access to menstrual hygiene products. Either way, again, both terms address an issue of access. So we have a varied number of folks in the room. Again, we have folks who are, have strong understanding of menstrual equity and period poverty and menstrual education. We have folks in the room who have, some knowledge, but don't consider themselves experts. And then we have folks in the room who are experts. And so I want to take an opportunity to talk about our role, no matter where you are in that continuum or in that spectrum of knowledge around menstrual equity, you have a role in menstrual equity. So regardless of your role within schools, and again, we're focused primarily on students, so I'm going to focus on schools. Regardless of your role within schools, you can support menstrual equity within your school environment. Since, again, this day is primarily focused on menstrual equity and education of students with the rollout of the new menstrual health education standards, again, I'm going to focus on the roles within schools, but certainly if you're in this training and you own an organization or you work for a company that supports menstrual health and education, or you're a parent ally or perhaps a concerned parent looking for more information about menstrual equity and education, you too are an advocate and support system for students and play an important role in championing menstrual equity. I wanted you to notice that I have learners on this list. A large component of the menstrual health education standards is getting students to be advocates of menstrual equity and helping them feel empowered to talk and learn about menstrual health and education, both within and outside of their school buildings. So on that note, if you're in the room and you work at a public charter school or DCPS, we encourage you to share the link that's going to be dropped in the chat for your students to register for the Student Summit this afternoon. So as I shared earlier, we have an opportunity today to sort of talk about menstrual equity concerns via 3 specific scenarios. And so this is an opportunity for sort of call and response. It's an opportunity for you all to share from your perspective and from your varied experiences and from your various roles in schools and outside of schools. This is an opportunity for you to sort of look at some scenarios, identify some barriers, identify some concerns, and then share how you would address the concerns in the scenario. And this is also an opportunity for you all to come off mute and hear from each other. So a little opportunity for peer learning. So we have 3 scenarios here. Again, I want you to look at the scenario, and I'll read the scenario out, but I want you to look at the scenario and then try to identify some key components here, like what things are indicators of concern and how you would respond to address the problem in the scenario. So I'm going to read scenario 1. This is going to be from a student perspective. We have Anaya here. She's an 11th grade student, African-American, cisgender girl. She puts her head down during class when you begin talking about the effects of contraception use on the menstrual cycle. You notice this and you ask Anaya if she's okay. In response, Anaya says, "Why are we talking about this? There are boys in this class and they shouldn't be hearing about the stuff we go through." Matthew then chimes in and says, "Yeah, this has nothing to do with me. Why do I have to learn about periods? That's a girl problem." You look around the room and notice other students in the class are nodding in approval. and you must respond to both Anaya's and Matthew's concerns. So I have 3 questions here. What stands out to you as concerning in this scenario? What actions can you take in your role, whether you are an administrator, a principal, a teacher, to support both Anaya's and Matthew's concerns? And then what affirming and positive information might be helpful for you to lean on? What is the unifying message for all that are involved in this scenario? So I'm going to be quiet, and you all should have the ability to mute and unmute yourselves. You can also utilize the chat if you want to respond in this scenario. Yeah, I'm gonna stop talking. I feel like I've been talking a lot. I'm gonna stop talking and allow you all to share and learn from each other.
Well, I'll certainly jump in and kick us off. Nigel, thank you for sharing this information. It's been wonderful. But I think one of the things that stick out for me as concerning in this scenario is, I would think, the lack of education and learning, which is part of what our purpose is today. And I think the most important thing is the piece we have, the conversation around whether or not all gendered students should learn about this, or even gender nonconforming students, transgender students, boys, girls, cisgendered boys and cisgendered girls should learn about all of this information. And I think the way we address that concern is that this menstrual health education helps us to all be aware, but then secondly, to ensure that there's respect and dignity for a menstruator when they're experiencing their cycle, and how we support each other, as well as how we understand how that might impact someone's ability to be attentive, focused, and/or present in any context they're in.
That's excellent, Taylor. Thank you for sharing that. One thing that stands out in what you shared just now is the importance, again, of sharing this information with all students, right? Not just our cisgender girls, but our transgender boys, our cisgender boys as well. And I think, Taylor, one thing that I would follow up with you and ask you if you could talk about a little bit here, not to take shine away from the session that you're hosting a little bit later this afternoon, is sort of like how do you respond specifically to Matthew as a cisgender male in this scenario? Like, how do you explain to him why it's important for him to know about the menstrual cycle? And I open that up not just to Taylor, but anybody else in the room or online today.
Sure, I'll respond quickly, but also leave space for others. I think I would definitely respond to Matthew in a way that helps him to understand that knowing about menstrual health education or menstrual health equity and understanding the process for menstruators is something that, as a cisgender male, he would want to be aware of. As he grows and matures, he will interact with persons who menstruate. And so having an understanding and having compassion about what they are experiencing will help him to be a more well-rounded person, and also have the ability to support any menstruators that he might engage with and throughout his life and throughout his journey of development.
Thank you, Taylor. Mm-hmm. Again, I open up the floor to anyone else.
Hi, I'm Noemi. I'm a student. I'm not a school administrator, but I just wanted to say that I think for me the best way to handle this situation would just be to explain it patiently to the students and explain why it's important for all people to all students to learn about this stuff. And I think that those reasons include first of all, people who identify as boys in that grade might eventually identify as girls, and maybe, or the other way around, right? People who identify as girls but menstruate, also need to, people who identify as boys but menstruate would also need to learn about this. And then the other thing is just guys need to be aware of menstruators, the things that they go through anyways, because I think that just helps build an empathetic person. So yeah.
Yeah. So one thing I'll share, just in commonality with what we heard Taylor say earlier, we hear that word empathy coming up over and over again, which is also a major component of menstrual equity, right? Earlier when we talked in the Slido poll about what menstrual equity means to you, a large component of it is being empathetic to the experiences that menstruators have, whether it is being empathetic to not having access to products, or being empathetic to the pain that's associated with the menstrual cycle, whatever it is, that term empathy I keep hearing reiterated. Anyone else want to come off mute on this scenario and share? If not, I'm going to move us forward because we are tight on time. Let's go to scenario 2 here. And we might end right here with scenario 2 so that we leave space for questions and answers. But in scenario 2, we are looking at this we're looking at menstrual equity from a staff perspective. And so for those of you that are in schools and working in leadership or teachers, this might be the scenario that you relate with most. So I'll read this quickly. You are a principal at an elementary school. You're holding a staff meeting to announce the new menstrual health education standards. And you share that implementation will begin in the 23-24 school year. During the meeting, 2 staff members expressed adverse reactions to the implementation of the standards for such young students. You are considering how to respond in order to build shared support across your school staff for the standards. Your health educator, Alan, who's a cisgender male, expresses frustration with the standards, saying, "I'm a male. What do I know about the menstrual cycle? And how am I supposed to teach about something I know nothing about and have never experienced? Am I really expected to teach this to 5th graders?" After a few head nods in the room, another staff member, an art teacher, a cisgender female, jumps in and says, "Personally, I don't like talking about my own menstrual cycle, and I definitely don't want students coming to me to talk about the menstrual cycle. Is this really the role of the school?" A few more head nods, and the attention turns to you to address these comments. How are you going to respond to this? Those of you all who are advocates and supporters, teachers, school nurses, I would love to hear from you on this scenario as well. How do you, if you're sitting in this staff meeting, how do you respond to your counterparts?
I don't want to put her on Front Street, but Dana Carr has shared in the chat a comment that was, I think, a part of last scenario, but I think it's really important for this scenario as well. And I'm just going to read it. Also, this is biology. There should be no shame in learning how bodies work. The more we name and discuss subjects that feel weird or embarrassing, the less power stigma has over us. It goes a long way to normalize menstruation and start changing social norms. So that might be a great response from an administrator to fellow educators at their school, but I think a really applicable response across the board.
Yeah, thank you, Dana. Unfortunately, I can't see the chat, but thank you for sharing that. And what we're already beginning to see is the common ground and the same line of communication that applies for multiple different scenarios and multiple different situations, right? The same response data that you provided in scenario 1 is also applicable here in scenario 2, right? So whether you're talking to students or whether you're talking to staff, either way, the same information, the same communication, the same verbiage applies. Thank you, Dana, for sharing that. Okay, I see some folks typing in the chat. Thank you. One thing that I will emphasize here from the school perspective is also understanding that this is a requirement, right? So we talked about, Dana's response, she talked about uncomfortability, right? The more we practice being uncomfortable, the more comfortable we get. But this is a requirement, right? This is not just something that's being handed down from OSSE to schools. This is law. And so whether we are uncomfortable talking about it or not, we still have to do justice to our students in providing them the information that they need to make the choices that are best for themselves in regard to their menstrual cycle.
And so we have another comment in the chat that says, "This is also a different generation we're educating. This is an opportunity to educate students, eradicate this taboo, and provide students with supportive environment through their entire school experiences. Teaching all students that this is a normal occurrence will change the view of menstruation for the next generation." Wonderful. I think this person might be an educator, but a wonderful response. And then following that, there's a response that says, "I mean, to me, in this scenario, the male teacher needs to recognize that his ignorance on this topic is an issue and that we're trying to avoid future generations for future generations, especially as a health educator, like it's his job. Needs to learn about it, talk to administrators, and maybe present with the administrator as well. But yes, absolutely is the school's role."
Yes, I love that.
Thank you for both of those comments.
Thank you, Taylor, for reading those out, and thank you to those who put that in the chat. I can't see the chat, so I don't see who that is. but that is 100% correct and right on par. Again, it may be uncomfortable, but this is a requirement. And I love the suggestion of teaching alongside a menstruator, right? Just to fact check yourself and make sure that you're sharing the correct information. So I love that. Thank you so much. Time is passing, so I'm going to move us on. I'm going to skip scenario 3 here and just talk briefly about what OSSE is doing to support menstrual equity for those who are educators in the room and those who are not. We want you to know that OSSE is committed to supporting the school's commitment to menstrual equity and the implementation of new health education standards. We are kicking off or have kicked off DC Menstrual Health Education Day, and we look forward to celebrating this day from this year forward. Part of the Menstrual Health Education Day is the rollout of those new menstrual health education standards. We are going to be offering new monthly office hours to talk about menstrual equity and the implementation of the new standards to support school staff around the implementation of the standards. We have our first office hours sessions today. Those are fully booked. So unfortunately, if you didn't get a chance to sign up for office hours, you missed it for today. But again, we're going to be continuing to hold office hours to continue to unpack menstrual equity and continue to provide support for staff who are going to be implementing the menstrual health education standards. We're going to be also unrolling a whole training program and a series of technical assistance outside of monthly office hours to continue this conversation. And so while today's trainings are just a kickoff, please look forward to more communication from us at OSSE. And then finally, we have a host of resources, right? So we have, again, the menstrual health education standards now available. We have a period products poster also now available in multiple different languages, in color and in black and white for school staff to utilize. We have a new menstrual health education webpage where all of these resources are posted and housed and live and able for you to access. Finally, I want to share with 1 minute left the Menstrual Dignity for Student Toolkit from Oregon State Department of Education. And then Period, who is an ally and partner of us here at OSSE, who also does copious amounts of research and releases white papers and all kinds of resources around menstrual equity and the menstrual movement. I want to close out with our contact information. You can reach any of myself at nigel.henley@dc.gov, Taylor Doctor. His contact information is here as well as Lizbeth Garcia Acosta, who again is both Taylor Doctor and Lizbeth will be facilitating sessions later this afternoon. I am available to stay on if there are questions. If not, I want to say thank you for joining us for this first session and to celebrate the first DC Menstrual Health Education Day, and hopefully we see you at another session later today. Thanks, everyone.